Good morning, everyone. I think we certainly heard from some of the students yesterday that they're very interested in hearing how things will go for them in the educational experiences and speaking on behalf of students to come. So could I just see the hands of students who are still with us today? Okay, we are all students, of course, but those who are in a formal educational program right now. I will be relying on the students to ask our first questions after the panel members speak today. My name is Charlotte Exner. I am here representing the Association of Schools of Allied Health Professions. I am a member of the Interprofessional Education task force that's working on that direction or that component of the strategic plan for that organization. I'm also the Dean of Health Professions at Towson University in the Baltimore area, where we have focused for many years on interprofessional education of our students. We do not have an academic health center, so we have a broad range of other health professions students, and we've invested in that in a number of ways. So I'm delighted to be here to help moderate this panel. I just would mention to you that in higher education, obviously, and the students know this well, those who are in formal education, that there is a rapid and intense transformation happening in higher education these days. The use of technology and other teaching learning methods and the driving force of our student learners today as quite different people who learn in different ways, who expect different things in their academic programs is also really creating a shift. I heard a presentation recently that talked about how we used to teach students, even in the US anyway, from kindergarten up through high school by putting them in brick buildings, which we still do, that are organized hierarchically in the model of factories. And it was designed structurally and educationally to support the students in being prepared for that kind of work in which they would be in a very orderly environment with a leader in charge of them down the road. And it was set up so that the students who were further along were clearly above those who were lower down in the hierarchy. Those who had more education clearly were superior to those who were at a lower level of education. And I think that concept, though, still permeates a lot of what happens and that is not always the most helpful for delivering or for supporting healthy environments and people's health and well-being. The other shift that is happening, of course, we see it right here, is the use of technology and what technology has done to flatten out the ways that we do a lot of things. Access, we hear everywhere we go about the MOOCs and how will that have an impact on education of students. How does technology make things more level as a playing field for everyone? I heard the other day a brief piece of a TEDx talk in which the speaker addressed the fact that we used to need to make people like the computers we have today. We used to need to have people memorize a lot, store a whole lot of facts, and be able to recall it very quickly. Today, computers and smartphones and everything else can create that kind of access. So what is it that we need to support our learners in knowing today and how they think and how they act? And our students drive this too, because our students want to work in teams. And we need to be sure that our educational models and systems don't discourage that kind of interaction, but in fact is really what we've been talking about today, or yesterday and today, about being so important in supporting going forward. So I'm delighted to have three panelists here to share with you some of the realities of developing and implementing the successes and challenges and barriers to supporting the interprofessional educational experiences that are a part of what is being talked about here today These are our sometimes our current leaders, sometimes our future leaders, and certainly our team players, and as someone mentioned earlier, sometimes the followers. So with that, I will let each of our speakers introduce themselves, beginning with Susan McDaniel.